Thank you for choosing MU Healthcare for your joint replacement surgery. Our entire team is looking forward to making your joint replacement experience a great success.
We have a great team of nurses who play a central role in your recovery and will help prepare you to go home after your surgery. Our experienced therapy team will help you make most of your recovery before surgery, in the hospital, and after you go home. We encourage you to participate in a strengthening program before your surgery and to continue this effort through the hospital stay and after you return to your house.
A case manager or specialist in social work will help create an individualized plan to help you recover well in your home after your joint replacement surgery. Our anesthesia team will see you before your surgery to make sure your medical conditions are tuned up and arrange any medical testing that is needed before your anesthesia. At the Missouri Orthopedic Institute, you have an entire healthcare team working with you every step of the way. We have learned that our patients recover faster and more effectively if they're engaging therapy services in an outpatient clinic than in their home. If you are physically able to walk 75 to 100 feet and are able to get in and out of a car, you will probably recover faster if you attend outpatient physical therapy than if you have therapy services at home. Surgeons around the country have been advocating for some patients to safely go home on the day of their surgery, and most patients have been going home the day after surgery for many years now. It's very important that you prepare your home for recovery. We recommend you have someone stay with you or check in on you for the first 1 to 2 weeks after surgery. You should also think about how you will get in and out of your house, especially if there are obstacles to work around. Do you need to make a flat path through gravel? Is it easy to access your front door? Do you need to clear a path to your garage? Will you need to manage stairs? If you have difficulty with balance, you may consider putting in a ramp or rail to help you to the front door. You should also have a cleared space to safely walk around your home. Pick up all objects that are loose on the floor. This includes rugs, extension cords, phone cords, pet toys, etc. If needed, move any furniture to make it easier to move around. Make sure you have handrails installed inside your home if stairs are present. If your bedroom is on a different level, consider staying on the main level until you are confident in going up and down stairs. We also want your bathroom to be set up so that you're able to safely and easily use the bathroom and clean yourself. We recommend sitting down in a shower chair. Many patients use grab bars inside of their shower for balance. Handheld shower heads are also useful. If you currently have trouble getting up and down from a toilet, it will be likely even harder to get up after surgery. For this, we recommend a toilet raiser to make the seat higher for you. Probably the most important thing to do before your surgery is to clean your skin. It's important to take showers daily during the week ahead of surgery. We will be sending a special soap called chlorhexidine home with you to help you clean your skin the day before and the morning of your surgery. The next most important thing is to keep your skin protected from damage. Every month we have patients whose surgeries have to be canceled because of cuts, scrapes, or scratches on their legs. This can be very disappointing when you've made personal and family plans around your surgery day. We would like to help keep every one of our patients from experiencing this disappointment. The best way to make this happen is avoiding the things that put you at risk for skin damage. Our favorite pets with claws can cause damage to our skin. The lawn may need mowing, or you may decide that you want to go out for a hike before having surgery. You may have a condition that causes dry or itching skin and may contribute to your feeling like you have to scratch in order to get pain relief. Your body needs to be working at its best to help fight infection. It's important to manage weight, keep blood sugar levels under control, to make sure that you have a good amount of protein in your diet, and to avoid tobacco products when you have surgery. Your surgeon may recommend delaying surgery until these things have been controlled. You will receive a phone call from one of our OR staff members on the day before your surgery. They'll provide you with information about your surgery time, when to arrive at the hospital, and final instructions on when you should stop eating or drinking before your surgery. You will not need to pack very much when coming in on your surgery day because you will not likely be staying here for very long. We recommend wearing loose-fitting clothing and having a pair of comfortable walking shoes to the hospital. You should bring a clean and comfortable pair of athletic shorts, warm-up pants, or sweatpants, and a comfortable t-shirt to wear after your surgery. If you want to purchase your discharge medications from our pharmacy, you should bring insurance cards, prescription cards, as well as a form of payment for your medications. Our nursing staff will take good care of you while you're in the hospital, but having someone with you will help you to remember the instructions you receive from doctors, nurses, and therapists. Surgeries at the Missouri Orthopedic Institute are performed on the ground level or first floor of the hospital. When you come to the hospital, we suggest that you come to the Circle Drive or valet parking at the front of the hospital. You will be entering the building on the second floor. Take the first set of elevators on the left to the first floor. The surgery check-in desk will be immediately to your right when you get off the elevator. If you come in from the parking garage, you will be entering the MOI on the second floor. After crossing the bridge, you will turn down the first hallway to your left. Follow the signs to the clinic check-in desk and the outpatient pharmacy. Turn left in front of the pharmacy and take the elevators on the right-hand side down to the first floor. The surgery check-in desk will be immediately to your right when you get off the elevator. We understand that you've just gone through a big surgery, but your surgical recovery process is going to be more work than relaxation. In order for our staff to help you and other patients in the best possible way, they need to have a predictable schedule of how and when to interact with you. You should plan on walking a little bit with your physical therapist or your nurse when your legs are awake and functioning. Getting out of bed on your day of surgery helps to speed up your recovery. It can also speed up the process of your pain getting better. Before leaving the operating room, a dressing will be applied to your hip or knee. We encourage our patients to leave the dressing alone. If you have questions or concerns about the dressing covering your joint, please let the nurses know. Members of our nursing team will help you to get comfortable in your bed. Please do not try to get up on your own immediately following surgery. Our therapists and nurses will be happy to assist you to get up and out of bed. There is a chance you can become constipated from taking pain medications or after being on anesthesia. We encourage patients to be aware of their daily water consumption, at least 8 glasses a day, as well as eating a fiber and protein-filled diet. It may take your body a couple of days to become regular. If you find you are having difficulty with bowel movements, we recommend trying over-the-counter solutions such as milk of magnesia or Metamucil. If you have not had a bowel movement within 3 to 4 days after your surgery, please call our office. As you discontinue narcotics and increase your activity, your bowel movements will become more regular. When you are experiencing pain or are drowsy from anesthesia or pain medication, your breathing may be shallow. This is the most common cause of a fever after surgery. You will be given a breathing device called an incentive spirometer. Every hour, you should take at least 5 to 10 deep breaths into your lungs through the device. Your goal is to make the piston rise to at least 1,500 to 2,000 with your deepest breath. We talked a bit earlier about clots that can form in your veins after total joint surgery or deep vein thrombosis. To prevent this from happening, you'll be wearing a portable device that squeezes the muscles in your calves and keeps blood flowing through your veins. We will perform a dressing change once before you leave the hospital. Most patients will be given 2 dressings to take home with you that are intended to be changed once every 7 to 10 days. Unless your wound is bleeding and saturating your dressing, we do not recommend changing the schedule for wound checking your incision. We check blood sugar levels after surgery. We have diabetes specialists help to manage blood sugar levels for our patients after surgery. Joint replacement surgery is a major operation. These procedures normally cause a significant amount of pain. Without anesthesia, this surgery would not be possible. Your anesthesiologist will manage your pain. The doctor will review your medical history and go over your plan, including a spinal anesthetic option. What is a spinal anesthetic? A spinal anesthetic is an injection of numbing medicine near the nerves in your lower back, so you can't feel anything below the waist for a few hours. Before the procedure, patients will receive medicines to relax you. Then you will also receive some twilight sleep sedation during surgery. A numbing injection will be required if having a knee replacement. This procedure is called a nerve block, and the medicine is inserted in the thigh, providing comfort for the next 12 to 24 hours. The injection is guided by ultrasound imaging. We will use a device that circulates cold water in a protected pad around your surgical incision. Cold therapy decreases inflammation chemicals and can help to decrease pain and swelling. While initially moving your knee or hip after surgery can reproduce pain, the process of getting the movement of the joint back as early as possible helps to decrease long-term pain, swelling, and joint stiffness. We will also use a combination of medications that help you control pain during the first days or weeks after surgery. While you're in the hospital, members of our team will work with you on a specific program to improve joint mobility, strength, and safe ambulation with an appropriate assistive device. After you are discharged from the hospital, you may either continue these exercises on your own at home, or you may continue to work with an outpatient physical therapy program. Most hip replacement patients do not need formal physical therapy after surgery. Most hip replacement patients will improve their function over time as they increase walking distance over time. For hip replacement patients whose recovery is not progressing as well as they would like, we may refer you to an outpatient physical therapist between 4 to 6 weeks after surgery. Because the early recovery of joint motion is important after knee replacement, physical therapy has a more valuable role early after surgery. You should ideally start working with an outpatient physical therapy clinic within 2 to 3 days and no later than 1 week after your hospital discharge. We expect that most patients will work with physical therapy formally for 4 to 6 weeks after knee replacement. Some patients may benefit from a longer period of working closely with a physical therapist. Others may be ready to transition to a strengthening program of their own at home or at a gym or at another fitness center close to their home. Your physician will let you know at your follow-up appointments when it is safe for you to begin getting back into physical activities. We know it's important for many of us to return to work after surgery. Your doctor will discuss with you when it is safe for you to go back to work after your surgery. Your doctor will let you know when they feel it is safe for you to start driving. Our team will be following your hip or knee replacement over the course of many years. It's important for us to know how your knee or hip replacement is doing so that we can continue to get better in the way that we help people with these surgeries.